after the fact with those folks who are busy providing care, so they weren't able to join. I think I have an agenda in front of me here, and it says that I'm going to say something. So to all of you who have logged in, to all our managers who would in turn help us to replay this to our staff at different locations, I just wanted to say good afternoon and welcome. And basically to share with you that what we're going to try to accomplish today is that we have two providers that we have spoken with. So the first half an hour would be dedicated to United Healthcare. They have given us a proposal, and we are looking at offering that plan to our employees. So the representatives from United Healthcare in the first instance will make their presentation. We have on the line Roger Walton. Roger Walton is a financial advisor broker for our company. And we have the representatives from United Healthcare, Ashley and some of her colleagues. So having said that, I would just turn it over to the United Healthcare team. Roger, if there's something you need to say as well.
No, that was well stated. No, I'm fine, and we'll just turn it over to Ashley so she can run through, because her program is pretty in depth, and we'll just want to make sure Ashley has enough time to go through it.
So go ahead then.
Okay, great. Did you wish for me to share my screen then so we can get the presentation up?
Sure. Okay, yeah.
Sure, we can do that.
Okay. So I'm going to go ahead and...
Yes, Philip is going to transfer the screen for your presentation to be up.
Okay, thank you.
May I say hi to Abby and Netra?
Hi.
I'm saying hi,
we are here.
Hi to Abby and Netra.
Hi, Beverly. We are here watching you. Listening
Yeah, I see you. So what we are doing is that we're going to have this recorded so you guys could play it back with your respective teams, okay?
All right.
Oh, here we go. There's Ashley.
Okay, so can you see the screen?
Yes.
Perfect. Okay, so let me maximize this here. Okay. So good afternoon, everyone. Thank you for dialing in. I know that we're looking at United Healthcare for 2017. I do have a lot of information I want to go over. The presentation will be made available so that if we don't get to spend too much time on some of the topics, you'll have that information to review at a different time. So I'm just going to go ahead and jump right into this because this is open enrollment, so this is the time to actually make any changes, add people that maybe weren't covered previously on your plan to the medical plan for 2017. So let's get right into the benefits. The first thing I want to talk about is our network. You guys are going to have access to the Choice Plus network, which is our national network of providers. It's available coast to coast. As you see on this slide, we have over 800,000 healthcare professionals, including labs, doctors, specialists, urgent care centers, over 5,700 hospitals, and over 30,000 retail pharmacies. So this is all great to know, but in terms of how to find the providers, we want to get you familiar with our tools and let you know there's 3 different options for finding physicians in your network. The first is going on to myuhc.com. You can actually click on a Find a Doctor button in order to search by physician or professional type, hospital setting, whatever it is you're looking for. You can also call the phone number on the back of your health plan ID card once you receive it. This way we can actually walk you through, our advocates can get an idea from you what type of provider you're looking for, help you look based on your certain area, and even send you a provider directory if need be. We do also have a Health for Me mobile app, which is a free download. It's available through the Apple Store or the Google Play Store, so that can be downloaded and have access to all of the great features from myuhc.com and the convenience of an app on your smartphone. What I do want to make clear is that all 3 plans offer preventive care and offer preventive care at 100% when you're receiving services by our in-network providers. So we have a really nice website, uhcpreventivecare.com, that you do not need to be logged in to see. It's a public site. And again, it's www.uhcpreventivecare.com. And by typing in your gender and your age, it'll give you a list of all the recommended services for you. But preventive care is in fact covered at 100% when you're receiving services by an in-network provider across all 3 plans. We do also have what we call a virtual visit benefit, which is a really nice alternative for not a replacement, but an alternative to like urgent care centers, and not a replacement for your primary care. But what this does is it allows you to connect with a physician through a video-enabled device like your tablet, your smartphone, or your laptop. They can prescribe medications and send that to your local chosen pharmacy. So in the situations like cold and flu season, if you have a child covered under the policy and perhaps they have pink eye and you just need those drops, if you have sinus infections, this might be a really nice alternative. And we'll talk about how this benefit is covered across the 3 plans. So when we get into the benefits, I want to make sure everybody understands just the basics about what the terminology we use to discuss what the cost-sharing responsibilities are. The first item here is copay. So this is the $6 amount you pay maybe for a prescription or for an office visit with a provider. A deductible, think of it like a car insurance deductible. It's the amount you pay first before the plan would start paying. There's one plan in particular that's going to have it's called a high deductible health plan, where the deductible would need to be satisfied before any services were paid. Co-insurance would be any cost sharing between yourself and the plan. So if it's 80-20%, that means that United Healthcare would pay 80% for services, 20% would be your responsibility as your co-insurance. And then, of course, the out-of-pocket maximum is the most you'll pay in plan year for all co-pays, deductible, and co-insurance for medical and prescription drugs. So here's the 3 plan names that you have, and these will be in the order that we'll look at the benefits. So the Choice Plus HSA is going to be the least costly option, and we'll talk about why that is and how that works, and one of the attractive features of the Choice Plus HSA plan, which is the health savings account, the HSA component. The second option is the Choice AFFK. That plan and the Choice Plus AFFY look very much like the same. The difference is going to be that that choice plan in the middle does not have an out-of-network benefit. And we're going to look at the plans a little bit more closely so we can compare the differences. So before we talk about each plan individually, I wanted to give an overview of what each plan offers. As you'll see that under our plans, there's no referrals required. They all have access to that nationwide network, that choice network that we discussed earlier. And you do not need to indicate a primary care physician. They all also include a pharmacy benefit. Where you'll see a difference here is that middle plan, that Choice AFFK, again, is the only plan that does not offer out-of-network coverage. So if you chose a provider that was not within the Choice network, there would be no benefit for those services. Now we'll take a deeper dive into the plan. So this is the high deductible health plan option. It's a Choice Plus HSA, and what that means is that under this plan, you must first satisfy the deductible before any of the co-pays or the co-insurance would come into play. The exception, of course, is going to be preventive care, which is still going to be covered at 100%. So on this plan, you have a $2,000 deductible or a $4,000 deductible, depending on how you were enrolled. And the out-of-pocket maximum for all medical and prescription drugs would be either $5,000 or $6,850, again, depending on how you're enrolled. If we look down here to see how these benefits read, you'll see everything says deductible, then, or a certain dollar amount after deductible. And that's, again, because by nature of this plan, all medical and prescription drugs have to first go towards the deductible before the plan will start paying. Again, the only exception being preventive care services. You will also notice on the lab and x-ray benefit, as well as the major diagnostic and the outpatient surgery benefit, there is a difference in the benefit level depending on where you go. So with that being said, if you go to a freestanding facility or if you have certain services done in an office visit setting, you're going to have lower costs out of your pocket than if you were to go for hospital-based services. And we'll talk about the reason behind that, but a lot of the times that's because the hospitals have higher fees when they include overhead expenses. The out-of-network benefits are illustrated towards the bottom of this slide, And the only note I'm going to make on the out-of-network benefits offered on any of these plans is that if you choose to go outside of our network, your deductible will be much higher, and your out-of-pocket maximum will, of course, be much higher. The out-of-pocket maximum, and what I want to point out for out-of-network providers, is that that amount is truly not a max, because unfortunately, out-of-network providers can balance bill you anything that is deemed to be above the allowance we assess for a certain covered service. So that's why when I discuss an out-of-pocket maximum, and I'm specifically looking at out-of-network benefits, try to be very careful in making sure that people understand if you choose to go out of the network, there's not financial protection like there is if you go to a provider that's contracted with us, because those are agreed upon rates that they will not balance bill you above and beyond for. And I said earlier that one of the things that makes this a plan attractive, in addition to its lower premium cost, is that it has an option to enroll in an HSA, in a health savings account. Those are accounts that allow you to put in pre-tax dollars. I do have a couple slides a little bit later in the presentation that'll go over the HSA component. But just know that if you're interested in an HSA, this would be the plan that you would have to enroll in order to take advantage of the health savings account feature. The next plan is the Choice AFFK. And again, the plan that we're going to look at right after this one is going to look very, very similar. The difference is going to be that on this plan right here, the AFFK, there is no out-of-network benefit. On this plan, you'll notice that there is no deductible, so everything is at a copay level, unless, of course, you're going to a hospital-based setting for any lab or x-ray services, at which point the benefit would be 20% coinsurance. Your copays for primary care versus the specialist are $15 and $30. That virtual visit benefit we talked about, the copay on this plan is going to be $15. On the HSA plan, it would be $25 as the copay for the virtual visit, the previous plan we looked at, only after the deductible's been satisfied. And again, you can see here for your lab and your x-ray, your major diagnostics, and your outpatient surgery benefit, you still have that incentive, that higher benefit for having those services done in either an office, a freestanding, or an ambulatory setting, depending on what, of course, the services are. Inpatient hospitalization will be covered at 100%, with your responsibility being $150 as a copay per day, up to a maximum of $750. The out-of-pocket maximum on this plan is $3,000 or $6,000, depending on how you were enrolled. And again, you'll see that preventive care is covered at 100%. So if we move on to the AFFY, again, you're going to notice this is very similar to the plan, the AFFK. The difference, of course, being the out-of-network benefit is now on this policy. So the zero deductible services are covered at a copay or coinsurance, depending on the type of service and the location where it's being provided, up to that same out-of-pocket maximum, which is $3,000 or $6,000. And what also is included in the out-of-pocket maximum is the prescription drug, which is not illustrated on any of these slides, but we're going to look at separately a little bit further into the presentation. You'll see the copay structure for primary care specialists, virtual visits, urgent care, emergency room, and then your major diagnostics or your outpatient surgery are all similar to that last plan. Again, the biggest difference being the fact that this plan offers an out-of-network benefit, whereas the AFFK does not. So when we discuss the incentive to use freestanding facilities or office visit settings, the reason that we do that is because those providers have lower costs for performing the same services that you can sometimes get done in a hospital-based setting. We do designate certain providers as a Tier 1 hospital, which of course would be lower cost to you if you are still more comfortable with having services done in a hospital setting. Tier 1 hospital status would mean that it would be lower expenses for you in comparison with another network hospital. But again, it won't offer you that same benefit as if you were to choose a freestanding lab or imaging center. None of the policies require that you choose a primary care provider or a referral to see a specialist, which is what we talked about before. And again, preventive care is still covered at 100% when services are rendered by our network providers across any of the three plans, including the high deductible health plan. This is just an additional slide that speaks to the Tier 1 hospital status. But on the right-hand side, I wanted to point out that freestanding facilities. So if you're familiar, our freestanding lab center is LabCorp, for example. Your previous provider may have had a different national freestanding laboratory preferred provider. Ours is LabCorp, so I just wanted to make sure that that was known. But again, you have 3 different ways to search our network, either online, through your mobile app, or by calling the customer service advocates. And if you have any questions about where to go or what your lower cost options are, those individuals and those tools are available to help you with that process. On that high deductible health plan, that first option that we spoke of, the Choice Plus HSA, here's where we're going to talk a little bit more about the health savings account feature, because this is really, in addition to those lower premiums, this is what makes that plan attractive. So HSAs are real bank accounts. They are your money. You can choose to put money in there on a pre-tax basis, and that money stays with you year after year. So if anybody is familiar with a flexible account, that type of account has a use it or lose it rule. There is no use it or lose it rule with a health savings account. When you put money into the account, it is pre-tax, it lowers your taxable income, and when you're using that money for IRS qualified expenses, that money is also not taxed. So we call it a triple tax savings account. To be eligible for an HSA, you must be enrolled in that high deductible health plan option, which is that first option we went over, the Choice Plus HSA. You also cannot be covered by any other health insurance unless it's a vision or dental plan. So if you are covered by a spouse's policy, let's say, and they have a PPO that has a copay structure, not a high deductible health plan, you cannot be covered or cannot be put into make contributions into a health savings account. There's also additional qualifications and IRS regulations associated with a health savings account. There's a really nice website that is www.hsaenroll123.com that has a whole bunch of information on there as well that'll give you some frequently asked questions and some more details about these types of accounts, eligibility rules, and the IRS contribution limits, which for 2017 are illustrated on the right-hand side. For those that are enrolling as employee-only coverage, you can put up to $3,400 in pre-tax savings into this 2017 HSA account. If you're enrolling at any other coverage level, it's considered family coverage, and you can put up to $6,750. If you are 55 years of age or older, you can also put in an extra $1,000 a year, which is what they call a catch-up contribution. I did also want to put these plans side by side just to show their high-level overview for copay, deductible, coinsurance, and out-of-pocket. So that HSA plan, you'll notice that the primary care physician and the specialist amounts are written as a copay structure after the deductible. And again, that's because by nature of that plan, all amounts have to first roll towards the deductible except for preventive care. That will include pharmacy, which we're going to illustrate a little bit deeper into this presentation. The deductible on that plan would be $2,000 or $4,000, followed by 100% coinsurance for most services. Again, if you go to hospital-based for lab and x-ray, you are going to have a 20% coinsurance responsibility, up to that out-of-pocket maximum, which would be $5,000 or $6,850, depending on how you're enrolled. Those next two plans, the Choice AFFK and the Choice Plus AFFY, again, are similar in structure. The very difference being the Choice AFFK does not offer an out-of-network benefit. But you'll see that they both have similar copays for the primary care and the specialist. They both do not have deductibles for when you're receiving care from an in-network provider. And the out-of-pocket maximums on both plans are the same, $3,000 or $6,000. So now let's talk about prescription drugs. As we said earlier, you have access to over 30,000 network pharmacies. You are always going to save money or get your best benefit when you're using a network provider, whether it's a medical provider or a retail pharmacy. We do have a mail order program for any maintenance medications. For those of you that are interested, you can simply manage your prescriptions on our website at myuhc.com. From there, you can refill your prescriptions. You can initiate mail order. You can find network pharmacies in your area. And the mail order option, what I like to point out is that if you are taking a mail order eligible medication, you're going to receive a letter from us the first time you fill it at the retail pharmacy. and it's going to explain to you this mail order option, how it's no cost when it's delivered directly to your home. You would just pay its applicable copay or deductible, depending on which plan you're enrolled in. However, we don't require that you use the mail order. What we do require is that you communicate to us whether you wish to opt in or opt out of our mail order program. So at the retail pharmacy, if you fill a medication that is a mail order eligible item for the first time, you're going to receive a letter from us. After filling it a second time, you'll receive a reminder notice if we have not received any response from you. If you take no action and go to fill that medication, that mail order eligible item again at the pharmacy at the third time, it will be rejected. And again, that's simply because we want you to make a decision and communicate that decision to us. But again, we do not require that you use our mail order program. This is strictly to make sure that you understand that this is a benefit available to you, and you will understand that there could be cost savings associated with that medication. Does mail order work for everyone? No, of course not. For some of us, we might be taking a new medication that our ordering physician is just trying out for us. Maybe we don't know if that dose is going to be good in the long run. Maybe we don't know if that particular medication is going to be a good fit for us for the long run. We may not be eager to flip it to a mail order status right at the first fill, which is why we give you the option of opting in and opting out as many times as you need to. So you can opt out at first to maybe take that medication a couple times at retail pharmacy and then later choose to make that a mail order item, or maybe that prescription ultimately changes based on your clinical reaction to it. Maybe that's not an eligible, not a most appropriate item to flip to mail order just yet. We do have different clinical programs in place to help us manage our prescription drugs, and I'm only going to quickly touch on these. So the first one here is a notification or prior authorization. Very simply stated, this requires your doctor to give us more information about what medication you're taking and why. That allows us to make a coverage decision on the particular drug in question. Supply limits are limits that are actually set forth by the FDA. It's the largest amount of medication covered per copay or within a certain period of time. So there are rules that the FDA has set in place that we have to follow. Step therapy is simply if you're taking a higher cost medication or if one is prescribed for you, we may wish to see which lower cost alternatives you've tried in the past. Our clinical programs are all clearly stated on our prescription drug list, which is the PDL. The PDL is the list of medications that we cover, how they're covered by the plan, and it's accessible through our website, myuhc.com, under the Manage My Prescriptions tab. This is an illustration of how the different medications, how the different tiers are covered across the three plans. You'll see the only one that has deductible amount written in there is combined medical and prescription deductible, illustrated for. And again, that is because on that type of plan, by nature, all medical and prescription drugs must first roll towards that one individual or family deductible before services are paid at a copay or coinsurance level. The only exception on that plan would be preventive care. Tier 1, Tier 2, Tier 3 would be $10, $30, and $50 once the deductible has been satisfied. On the other two plans, you'll see there's no deductible applicable, and the copays are slightly different, $10, $35, or $60 for the Choice AFFK or the Choice Plus AFFY. Using mail order, you can see that there is a savings associated. The cost would be 2.5 times the retail price. So the pharmacy payment process, just for those that may not be aware, when you go to the pharmacy, everything is processed in real time. So with medical providers, they have to submit a claim to us. The claim has to process through the system. Then an explanation of benefits is released showing how much the patient responsibility is and any payment that's made to the provider of service. With pharmacy, it's all done right there on the spot. You present your health plan ID card that has the pharmacy information in the little box at the right-hand corner. And then the pharmacy will verify your eligibility and any amount that you owe at the point of sale for that particular medication, depending on its tier, Tier 1, Tier 2, Tier 3. You then pay the cost at the pharmacy and leave with the medication. Under that health savings account that we spoke of, that first plan option, because your flat prescription drug copays do not come into play until after that one medical prescription combined deductible has been satisfied, this is where a lot of people will use and take advantage of that health savings account. because you can put money into that health savings account to help pay for the cost of prescription drugs. The people I think that are most surprised by the cost of prescription drugs are those that enroll in the health savings account. We do also have a specialty pharmacy program in place. This is going to provide additional clinical support, not meant to replace any relationship you have with a specialist or a long-standing provider, but this is going to give you additional resources that you can use to help you best manage your condition. Conditions include cancer, hemophilia, hepatitis C, MS, RA, HIV, and there are more. So again, this is a program that's available to anybody that may be taking a specialty pharmacy medication. It would be through our specialty pharmacy, Briova RX, and our specialists that are available through United Healthcare can help you with this process of getting this in the works and helping your provider communicate any information needed in order to get you enrolled in the specialty pharmacy program. We do have other benefits I want to touch on really quick, and these are all pretty much tools that are associated with our website. One thing, and I think this comes in handy most often for those that are thinking about enrolling in the high deductible health plan. When you are enrolled in the plan and you have access to myuhc.com, you can actually estimate the healthcare costs for certain procedures and services. You would go to the website, myuhc.com, and log in, and then there will be a green button that says Estimate Healthcare Costs. You would type in the name of a procedure, and it'll show you by area and by provider associated with that chosen service. This is all based on actual claims data for our network providers. So we're trying to give you the most clear-cut estimate for what your healthcare costs may be for a chosen procedure. We do also have a premium designated provider program where physicians that have been through a gamut of testing on different measures as far as practicing evidence-based medicine, their cost of care for total episodes of treatment, those doctors that have found to exceed expectations and have high standards of clinical care are designated with premium designation status. And that's all designated on our website when you're searching for a provider as well. So these are doctors who meet quality standards and also cost efficiency guidelines. Rally is our health and wellness portal, and I think this is a benefit that not enough people are really taking advantage of. When you go on through myuhc.com, you can click on Rally directly from the landing page, or there's a health and wellness tab. But what's really nice about this system is it's interactive, and it's a gaming system. So when you first go through Rally, it's going to ask you to set up a health survey, which is a questionnaire that takes about 15 to 20 minutes to complete, focusing on different aspects of your life. And it's getting feedback on your health habits, your overall habits, your eating habits, and trying to get some information about you in order to make recommendations on a healthy lifestyle path. Once you complete the health survey, you'll get a health age, which might be a couple years above or below your actual age. And it also recommends some missions that you can enroll in or some challenges that you might want to consider participating in. The nice part about this is as you're interacting with Rally and either signing up or completing these different missions and different activities, you're going to be rewarded with coins that you'll see illustrated in the top right-hand corner of the screen. Those coins can then be entered into sweepstakes for merchandise, whether it's gift cards or fitness merchandise. Sometimes there's Rachel Ray cookware on there, iPads, mountain bikes, and then gift cards for national retail vendors like Amazon, Whole Foods, Fandango, other gift cards as well. Rally is much like Pandora, if anybody's familiar with that. So the more you use it, the more it gets to know you, and the more customized it becomes. We do also have a healthy pregnancy program. So for any expecting mothers, you can enroll in the healthy pregnancy program by calling the phone number in the back of the ID card. You'll have access to nurses. It, again, is not meant to replace the relationship you're going to have with your OBGYN, but it's an additional line of resource for maybe those hours where the OBGYN team isn't available, and you just have questions in between your appointments. There's also Nurse Line, which is available 24 hours a day, 7 days a week. You can call and speak with a registered nurse about maybe a recent test or a procedure that your provider is discussing with you. If you need help deciding whether your visit to an urgent care center or maybe a follow-up appointment with the doctor's office may be appropriate based on your current concern. Your questions about any benefits or help resolving a bill or a claim, or if you need to find a doctor's appointment or schedule an appointment. These physicians are available 24 hours a day, 7 days a week. So I know we went through a bunch of information. This deck will be made available to everyone. I'm not sure at which point we want to open it up to presentations, but I'll go ahead and turn it back over to Roger.
Great, thanks, Ashley. I appreciate all that. Let me just ask Philip, are we in a position to allow any folks to ask any questions that they may have?
Sure. Let me just open up the chat or the mics. Well, it looks like everybody's mic is on.
On, okay. So let me ask, does anyone have any questions at this time for Ashley in reference to the medical plan that was just explained with United Healthcare?
I got questions.
Okay.
Hello, can you hear me?
I can.
Yeah, we can hear you.
Oh, now I'm a diabetic. I don't really understand which one would be the best for me.
Mm-hmm.
Which
Right.
plan?
Which plan? They all seem similar except the one in the middle, and that's only because they don't have a network, don't have the network thing.
Correct. It doesn't have the out-of-network benefits, that plan in the middle. But the first plan is quite different than the other two, because the first plan is an HSA, meaning that you're going to have deductible for everything before you would start paying any co-pays or co-insurance. Whereas the other two plans may be more, the other two plans, do not have a deductible for services including RX. Now, I can't tell you what's going to be the best decision for you, but what I can tell you is the people that lean towards the health savings account options are those that don't regularly have any visits with specialists, that maybe go for their preventive care. Maybe they have one sick visit a year, and they're willing to take that chance that, you know what, if I have to go for services, I'm just going to go and I'll actually just pay the deductible. I'll put some money in my HSA. But they're not really using medications, because then they don't have to worry about the higher cost of prescription drugs before their deductible is satisfied. Those are typically the people that we see gravitate towards health savings accounts, because those deductibles are higher than other options they're presented with. So for individuals that may foresee longer or more frequent care with different specialists, depending on their need, or if they have different medications they take on a regular basis, one of the other two options may be better suited for you. Then what it would come down to is, do you have to have out-of-network benefits, or are you comfortable with only staying within the confines of our network, which is, again, very large. We're over 96% of all U.S. counties.
So that would be AFFK.
AFFK would be that, let me go back and make sure. I believe that's that middle plan.
Good.
AFFK is the middle plan that does not have an out-of-network benefit. So as long as you have providers that are all in the network and you're comfortable with only seeing providers in the network, then that plan might be most appropriate for you. I don't want to discourage anybody from the HSA account, but we typically find people that are not expecting to have a lot of care throughout the year gravitate towards those plans, because they just assume that if they have to go for services, they'll be comfortable with paying the deductible, because they don't believe that they're going to encounter the deductible on the policy.
I have another question. How much is it per month? AFFK.
Okay, let me just jump in there and say that right now here's the numbers. I'll just give them to you so you'll know what they are. And before I give you the numbers, though, let me just say this to you, and I agree with what Ashley was just pointing out. All those points were just right on point. But let me just explain to you that the way that when you think of healthcare coverage, I want you to think of it in this fashion. The more the insurer pays, in many cases, the higher the premium. The more you pay as an individual, the lower the premium. Just want you to put that in your mind as you kind of decide which direction to go. With that,
the more you pay, the lower the premium.
Correct, right. The more that's coming out of your pocket, then technically, in many cases, the lower the premium. The more the insurance company is going to pay, in many cases, the higher the premium. Okay?
Okay.
And that's the mindset that you just kind of, again, just have to kind of gravitate to when you're thinking about healthcare coverage. And all those points that Ashley just made are definitely viable areas that you need to consider also. All right, so the Choice Health Savings Account plan right now, and again, a reason why I say right now, because these costs are going to be dependent on the number of people who enroll in the plan. All right. So right now, the cost will be $700, and I'm just going to give you a round figure if that's okay. I'm just going to give you $765 for the health savings account. That's the monthly premium for the health savings account. Okay?
I'm sorry, $755 a month, right?
$765 a month, correct, right.
A month, okay, thanks.
Yep. All right. Now, the Choice plan, the AFFK, is $1,102 a month. And again, I'm just rounding the numbers up, so just $1,102 a month. All right. Now, the Choice Plus cost is going to be $1,145 a month. Okay, so I'm just going to repeat that for you so we'll make sure that you're clear. So the Choice Health Savings Account plan is $765 a month for a single individual. And these are all single rates too, by the way. And the Choice plan, I think, which is the AFFK plan, that's $1,102 a month. And then the Choice Plus plan is $1,145 a month. So again, going back to my initial thought was that the more money that you put out as an individual, the lower the premium.
And Roger, just to add to that, because that you bring up a really good point. So what I also tend to tell people is, like, when you're thinking about the high deductible health plans, because they're usually your lower cost options, you're paying less to have the plan, but more money when you need to use it. So you're paying more at the doctor's office or more at the pharmacy because you're paying less in your premium on a monthly basis or a biweekly basis. Whereas with the other two plans, you're going to pay slightly more money just to have the benefit, but less when you need to go actually use the benefit. So less when you go to the doctor, less than when you go to the pharmacy.
All right, great. Thank you for that. Are there any other questions in reference to the United Healthcare plan? Yes, okay.
I'm Albino Panik from Harrisburg. This Choice Plus HSA shows $2,000 deductible for employee only. Does this mean that the insurance company does not pay for anything until $2,000 are existed, or we are paying like some percentage both ways?
What that means is that you have to pay the deductible before the plan starts paying. So let's say you go for, and we're not going to talk about preventive care because preventive care on this plan is still covered at 100%. But let's say January 2nd, you go for a sick visit with your doctor. If the doctor charges $100 for the sick visit, the $100 would be your responsibility as applied to your deductible. So from that, if you're covering yourself as employee only, your deductible was $2,000. Once you have that office visit, your deductible would then, the remaining deductible would be $1,900. Okay, because you would owe $100 to your primary care doctor or your specialist for that visit. Whereas on the other two plans, if that same visit cost $100, your responsibility would be only a $15 or $30 copay, depending on what type of provider you're seeing. So anytime you have a plan that says deductible first, essentially, which is what that Choice Plus HSA plan is, it means that you have to pay or you have to satisfy that full deductible before United Healthcare starts paying on the covered services.
Okay.
And that's why people will then kind of put some money into their health savings account, because then they can use that money for payment for services that where the deductible is being applied, whether it's medical or pharmacy.
That's my question. So they would take like $500 out of each one of our checks a month?
Yep. That was my question. Was I already have been having money taken out of my check, whatever it was for one person, $15 or $7. So that isn't the correct amount then. So how do you back out of the insurance then?
Okay, I'm not sure if I follow your question. Give that to me again.
Sorry. Okay, so they've been taking money out, I think two pays already so far. They took payment out. I think it was like $7 or $15 each time.
Mm-hmm.
So I was a little just, I didn't realize how much it was. I'm not going to be able to do that. So when we back out, because it's going to be that money plus, say, $1,045 a month, they take out of your check.
Okay, yeah, sure. Let me explain how it's going to work here. Right now, TriMed is going to be offering 2 health plans.
Okay.
You're going to be able to select the 2 health plans. The one that you have right now, I'm pretty confident, is with a company called Reliance Standard, and that's the current plan that's being offered. And TriMed has just decided that, hey, you know what, we just wanted to offer something just maybe a little bit more robust, and for those employees who want to gravitate towards that, so you're going to have an option of either selecting this plan or selecting or keeping the Reliance Standard plan.
Okay, that clears it up. Thank you.
So you're going to still have your option. So, matter of fact, I don't know if Joe is on the line.
I'm here.
There you go. All right, good man, Joe. I appreciate you. We're going to just want to make sure we answer all the questions in reference to United Healthcare, and then we're going to transition into the Reliance Standard, and Joe's going to talk about those benefits under Reliance Standard in a few moments here. But I just want to make sure that we have all the questions answered when in reference to United Healthcare and what Ashley has just talked about.
I have one more question.
Yeah.
To United Health.
Yeah.
Mm-hmm.
Yeah, that for the first type of plan, you're saying that 765. Is this like going from employee's check, or is will this be like part of this? A bigger part of this will be borne by the company. I mean agency, TriMed.
Okay. Are you asking, is TriMed going to make a payment? Is that what you're asking?
Yes.
Yeah, we're leaning towards that direction. Let me just say, TriMed is leaning towards that direction. We're trying to get a consensus of how many people are going to enroll in the plan, and then we'll know exactly what the numbers are going to line up and with what TriMed can do. So that's where we're aiming towards right now, to really try to let folks know that there's a robust plan out there that we feel that's definitely going to help to meet their needs, along with the Reliance plan. And then once we determine how many folks are going to be enrolling in the United Healthcare plan, that will determine exactly where TriMed is going to line up when it comes to any cost help, if you will.
Yeah, because these numbers are too high, because many of the employees do not make this money in a month, and if we take TriMed will come back. If we have more number to help, then nobody's going to choose this.
Correct, right. And again, we're just trying to make sure that we're just offering a robust and employee benefits package. So I just want to say to you that that's one of the concerns of TriMed Healthcare, is to make sure that they meet the needs of all the employees. That's why we started out with the Reliance plan, to make sure we were able to address the concerns there. Now we've added this particular plan in place, and they're looking to add other employee benefits in the mixture also, just to make the plan as robust as possible. But here's the beauty of it. The beauty is that whatever employee feels they need in order for them to be able to balance that work-life atmosphere, they will be able to grab onto whatever plan fits best for their need. And that's the beauty of it all, when it's all said and done.
Okay.
So we do understand the concerns that it's expensive, but at the same token, I mean, United Healthcare is one of the better priced products out there. We've done our research, I would say that, again, the pricing may seem somewhat expensive, but again, if it meets the need, then I'm pretty sure some employees will go ahead and gravitate towards this and go ahead and get this plan, because, again, it helps to balance that work-life relationship that they're trying to enhance.
Okay, thank you.
All right. You're welcome. All right. Any last questions in reference to United Healthcare? Going once, going twice. All right. Great. Well, I just want to say thank you very much to Ashley. We appreciate you, Ashley, and what you had to offer. I mean, that was good information. And if we want to hang on, Ashley, that's fine. I do know you have other things to tackle and so forth. So we do appreciate you being on the line, though. And so at this time, I want to go ahead and just transition over to Joe. Joe is from Reliance Standard, and Joe is just going to offer some information in reference to the other plan that was in place from last year in reference to for TriMed and the employees there.
All right, thanks a lot, Roger. I appreciate it. Once again, my name is Joe Bartonbeck. I'm with Reliance Standard. For those of you that are unfamiliar with us, we are a Fortune 500 company that's headquartered right here in downtown Philadelphia. We have been offering the insurance to TriMed we did this last year is when we rolled out the initial rollout of the program. So we do have quite a few employees that are currently enrolled in this. So that's really where I'm going to spend most of my time today, is focusing on how these new occurrences are going to impact them. So for us in our plan, nothing has changed. The price is still the same. The plan that we offered to employees last year is exactly the same, and I'll dive into those benefits and the details and the pricing here in a minute. So when we're going through that, as you're explaining to your employees and the people that work underneath of you in your various departments, trying to educate them on this. If they are currently enrolled in our product, they can stay with us. If they did want to drop our plan and move on to United Healthcare or something else, they will need to submit a waiver form to us. So this is our open enrollment period. This allows any employees that are currently enrolled to make any changes, so they can drop the coverage, they can add dependents, we're also, the big change that we rolled out this year is we're also adding the dental, life, and disability. So I'm going to be hitting on all those products and how employees can enroll and what they need to do going forward here. All right, so let me see here. I lost my screen. Do we have the presentation up here? For whatever reason, now my screen is frozen. Am I the one that's not seeing the screen right now?
No, I think, yeah, I'm only seeing a email portal here.
Yeah, we can email.
Possible to bring up that proposal presentation for Reliance? Okay. Give us 1 second, folks. We're just trying to bring up the Reliance presentation here. Philip, are you there? Joe, are you there? Can you hear me?
Yeah, I'm here. I can hear you.
Okay. All right. Let's see. All right. So I can't hear the other group. Okay. So something happened here. So we just told them no. Okay. Okay, we're just having a little bit of technical difficulty here. They're about to get us back on track. Let's just see here.
I mean, I can keep, you know, kind of dive into some of the other features and all if you want, Roger, without the, you know, I can dive into the benefits and the details in a second, but if you want me to hit on, I guess, more about the open enrollment period. And I know I shot you an email earlier. Have we ironed down what the deadline is for employees to submit their decisions?
Mm-hmm. Okay. All right, so are you asking a question, Joe? I'm sorry.
Yeah, I was just asking you. I'm just trying to, I guess, fill time here.
Yeah,
they're trying to fix stuff right now, Phil, and they're trying to get in now.
Okay.
You're
Can you hear us?
you couldn't hear them. There they are. Okay.
You can hear us
Yes,
now?
we can hear you. Yeah, we can hear you
Okay,
now.
we're back. All right.
Yeah.
So
If you can,
we're-
can you bring up that presentation for Reliance Standard, Sil?
yeah, I can. Let me just.
Okay, great.
Am I going to need to like redo this, like log back in? No, here it goes. Looks like something's happening.
No, I hear you okay, Joe.
Yeah.
Here
All
we
right,
go.
perfect.
All right. Now, there was another presentation, Phil, that had Reliance information in it. I don't know if you...
Hold on for 1 second. Let me go get it.
Okay. All right. In the meantime, Joe, can you just go ahead and just speak to the the medical coverage and so forth that's being offered by Reliance, and then by the time he gets it back
Sure.
up, and then we'll transition into the voluntary benefits and so forth.
Sure, not a problem. Yeah, so for the employees that are currently enrolled, like I was saying before, we're doing the same exact plan at the same exact price again this year that we did for last year. So employees that are currently enrolled, there's no change or impact to them. If they want to make changes, now's their time to do it, like I was saying. Sorry, somebody have...
Hello?
Hello?
Hi. My name is Rosa.
Okay, great.
Okay, yeah. Let me just
There we go.
let me just interrupt if you could real quick. If there's anyone new joining us, we're glad that you're here. But do us a favor if you can just maybe just mute your phone so while Joe gives his presentation in reference to the healthcare coverage, and then towards the end he's going to allow for opportunity for questions, and then that way you can unmute your phone and then you can share. And it's very important that you mute your phone because sometimes we hear background noise and so forth. Thank you.
Mm-hmm. Thanks, Roger. Yeah, so again, we're doing the same thing this year as we did last year at the same price. And once we get the presentation up here, I'll dive into some of the benefits in a little greater detail. But just to reemphasize what we offer versus what the discussion earlier was regarding United Healthcare. Now, what we offer is called minimum essential coverage. Okay, so this is what the government has now deemed in the era of Obamacare and the Affordable Care Act that this is what constitutes the minimum coverage required by an employee to have in order to eliminate and satisfy their need to have insurance. Okay, so by employees that enroll in this product, there's a penalty out there called the individual mandate that if you as an individual do not have insurance, you are penalized to the greater of 2.5% of your income, or in 2017 it's $695. Okay, so by an employee enrolling in this product, they satisfy that need and therefore will not get penalized at the end of the year. Okay, so this is not...
Excuse me for 1 second. Joe,
yes.
You've got control of the mouse, so you can control it.
Ah, perfect. All right, thank you.
All right, there you go.
Awesome. There we go. Okay, so as we're looking at the screen here, I'll dive into some of the details of this in a minute, but again, to hit on the affordable side of this and what this plan does, this gets the employee out of the penalty, satisfies that need, and it gives them access to, as Ashley was saying on her call, similar to United Healthcare, all preventative services are covered at 100%. So things like your annual physical, mammograms, a lot of these, there's 63 required services under the Affordable Care Act that you have to offer your employees. They have to have covered at 100%. So, and I'll hit into the benefits here as well. So when we're looking at here, here's our basic advantage plan. Again, same thing that employees currently have. This is completely open access, so you can visit any doctor. We do utilize a network called MultiPlan. The website is multiplan.com. There's over 900,000 providers in it nationwide. It's one of the largest networks there is. But the benefits that are listed here pay out exactly the same, regardless if you go to an in-network provider or a non-network provider. The difference is if you do go to a multi-plan provider, you'll take advantage of the discounts. Again, there was an example earlier given of a doctor's visit. So if I'm using my mouse here correctly, let's see, go down. So as we go to the doctor's visit section here, let's say you go to your provider and the charge is $100. Well, we're going to be paying $75 or $60 depending on whether it's your first visit with that doctor or if it's currently an established provider that you go and see. So let's just use $60 as the example. So your provider is going to charge $100 for that visit. We're going to pay $60. You're going to get a bill in the mail saying you owe us $40. If it's a multi-plan provider, that charge might only be $90. Okay, so we're going to be paying $60. You're going to owe $30. So you're just saving on your out-of-pocket costs. These plans have no deductibles. There's no co-pays. It's strictly based on the dollar amounts that you see there are what we pay towards the provider for a service. Okay? Just a few more things on this left-hand side here too. One of the neat items that's included in this benefit is also VSP is our vision carrier. That's our network. You get a discount for any eye exams, frames, lenses. You get up to a 20% discount. That's free. It's embedded in the cost of the plan. All right. Moving on here, I know we had a nice discussion earlier. I was listening in on the prescription drug benefits. Whoops, looks like I skipped a little too far here. Let's go back. Bear with me as I'm moving the screen here. Come on. Okay, so prescription drugs here at the bottom. Okay, so here's a big thing. I know somebody was mentioning earlier about diabetes. This is something that, again, this is not comprehensive major medical. If you're somebody that does need and can afford the comprehensive major medical plan, I always recommend people to go that path. Okay, so for us, we are a means to give you some, get you out of your penalty, but at the same time give you a certain level of benefits as well. So for prescription drugs, if it's a generic prescription drug, we pay $25 towards the cost of that prescription. Okay, so if you go to your pharmacy, and honestly, every CVS, Rite Aid, you name it, they're in network. Our network is Express Scripts for our pharmacy. So when you're looking at the benefit, you go into your pharmacy. If your generic drug costs $20, well, we're paying all $20. The employee's not going to know anything at the register. If your generic drug costs $30, we're going to pay $25. The employee's going to owe $5. And that all happens at the register. Your medical ID card that you will receive from Reliance Standard also has the Express Scripts pharmacy information on the same exact card. Okay, so when you go into your pharmacy, you can just show your card. It's all going to happen at the register. So it's not a matter of paying 100% of the cost of the bill, sending us a claim form, and waiting for a reimbursement. We pay all of that at the register. Okay? So the next page here, the next slide is going to be the essential plan. This is the part of which that meets the requirements for the Affordable Care Act. Okay. So here, somebody have a question there?
No.
Okay. All right. So as you're looking at the plan here, again, when you're looking at this is the essential plan. So this is the ACA Affordable Care Act required program here. So as far as what is covered, when you look down here, covered services for children and adolescents. Now there's 63 overall. We just summarize this because everything's basically just a subcategory from here. So well child exams, physical, pretty much all of their vaccinations and immunizations, screenings here, so for hearing loss, so on and so forth. Same thing with adults. It's going to be all of your preventive things such as your annual preventative service exams, so your colonoscopies, OBGYN, immunizations for hepatitis, influenza, so on and so forth. Those are what's really just covered under that essential bare bones component. All right. Now moving on to what we're also changing. This is the only thing that's different this year from last year is that we're now offering you a chance to purchase dental insurance as well as life and disability insurance. Okay, so from a dental perspective, here's a list of what the program looks like. Okay, so plan has a $1,000 maximum. Okay, what that means is, of course, for any given year, the amount of money based on our co-insurance, so if we're paying 80%, you're paying 20%, the maximum we will pay out of our pocket is going to be $1,000. Okay, so based on the tiers here, you can see what's happening, types of charges, the percent that we pay Reliance Standard, you would pay the difference in that percentage. So for a checkup and routine cleaning, you can go to any dentist. This is completely open access. There is a $50 deductible, so as soon as you walk in, you will have a $50 charge that you're waiting for you as soon as you walk in the door. But let's say that cleaning is $100. Well, we're paying $80. The employee's going to owe $20. Okay, and that's the way it works for all of those benefits as you go down. I'm not going to hit on each individual one, but when you look at how these plans work, understand that's what the co-insurance is. We pay $80, employee owes $20. As you go down to the next tier, you're looking at fillings. Filling, let's say it's $500 to get the filling done. We're going to be paying, $300. The employee is going to owe $200. All right, one more slide here, and then I can open up to any questions. Life and disability. This is two plans for the same price. Okay, so When you look at this, you don't have the ability to just choose life insurance or just choose short-term disability. You get both for the price, okay? So when you look at this, an employee can, again, this is going to be voluntary, so if the employee wants to do it, they're going to pay for the price. $10,000 benefit. You also get a $5,000 benefit if you want to elect it for your spouse or your dependent children. It's $2,500. Short-term disability, this is a big one. I know it's not the richest of benefits in the world, but I really do believe in disability insurance. If you cannot work for any specific reason due to an illness or injury, this at least helps put some money in your pocket to offset some out-of-pocket costs you might have. So the way this works is that if you become disabled, unless you're hospitalized right away, the benefit kicks in immediately. But if you are not hospitalized, you have to wait 14 days for the benefit to kick in. That's the elimination period. So whether you're sick or injured, within 2 weeks, this benefit will start to pay out and will pay you for a duration of 26 weeks. And the way this works, it's going to pay you a maximum of 50% of your income or $125, whichever is, or a maximum of $125. So, and that's per week. All right, so if you do become disabled, you can get roughly about $500 a month back into your pocket if you can't work. All right, let me move on down to the next, see what else is on here. All right, the only other thing I'm going to point out, and I don't think it's on here, but the application. This is important for, especially for the employees that are currently enrolled and anybody that wants to sign up for the dental or the life and the disability. Okay, so regarding our current plans, if anybody's currently enrolled in the essential plan and the medical plan through us, if they do not want to make any changes, you just want to take what you have and move on, then you can just, you don't have to do a thing. You don't have to refill out a form. You don't have to do anything else. Okay. If you are looking to sign up for the medical plan for the first time, obviously you'll need to complete an application. It looked like it right there. Yes, perfect. Thank you. Thank you, Philip.
No problem.
All right, so here's the application. So if you're signing up for the medical plan, the cost is right there on the left-hand side. So if you're an employee only, it's $15.18 biweekly. Okay? So if I want the medical plan, that's what I would elect. If I'm currently on the plan, I don't need to do anything. Let's say I am currently on the medical plan, but I also want to sign up for dental. Okay, well, if you would need to, in this situation, check the medical box again and the dental box. You cannot just check the dental box, because if you're enrolled and you send in an application that just has dental, we're going to assume you waived coverage, you're declining coverage. Okay, so if you are currently enrolled, check the medical box, check the dental box, and then submit it. If you just want to sign up for dental or life and disability, you are not interested in signing up on the medical plan, you still need to complete this form. But as you can see, the very bottom box says declined coverage. You would check the declined coverage box for the medical, but you would check whichever other benefit you are electing, so employee-only dental or employee-only life and disability, and then send us your form. Okay, so I just want to make sure that employees that are currently enrolled or looking at enrolling in the other options, make sure that they know what they have to do. Okay, other than that, I think that's pretty much it. I tried to go through that pretty quickly because I know we were kind of under a time crunch here. So are there any questions?
Do we get cards from you?
You do.
Which one?
You do. You'll be getting a medical ID card in the mail, and again, that ID card is both for your medical and for your prescription drug.
Okay, great.
Alexandra, they're sending you a new card because you didn't receive the one they sent, so they're resending it.
Okay, because I think I was doing this plan, not the United Healthcare.
Correct.
Yes. Okay. Thank you.
And it's also a good point, too, since we are in the open enrollment period. Again, if anybody is currently enrolled, and if anything has changed, you have if you want to add a child, you want to add your spouse, you're waiving coverage. Let's say you moved your address, you moved and now your address changed. You don't need to submit any claim forms or forms to us, but just let us know that those things have happened. That way we can update our files.
The dental plan come out every 2 weeks, and the term life plan come out every 2 weeks also?
Yes, so all of those pricing that you see there on the application reflect biweekly pricing. So every other week in your paycheck, that's what would be deducted. So if you're an employee only, it looks like $8.90 for your dental plan and $8.50 for the life and STD.
We'll say employee family $8.90, and then one say, I'm sorry, I'm looking at the dental. Okay.
Mm-hmm.
I understand it.
Yeah, there's not much difference if you're scratching your head on the pricing there between the life and STD plans. Why is it $850 for an employee only and then $890 for a family? Well, because family does not include short-term disability. Short-term disability is just for the employee. If you're signing up for your family, if you're signing up for family, it's going to be just for the life insurance.
I have one more question. Do I put my children's name on section, on the other sections if I'm just putting them down for term life, or I leave that blank?
Yeah, if you're signing up any dependent children for any of the coverage, we do need to have their name, date of birth, and social security number.
Okay.
So if it's a family of two, like it's just me and my daughter, if I wanted to add her for medical, because she just got, I need to have her covered now. So do I just do? Is there one for me for her?
Yeah, I mean, if you want to. Yeah, I mean, all those benefits will be for two that show reflect one person. So let's say you would just sign. You would be electing employee child. So there's two other tiers there. You have employee. So if you're talking medical, you have employee, employee spouse, employee plus one child, or employee plus children. Okay, so in your situation, if you're talking the medical plan, you would want to elect employee plus one child. If you're doing it for if you're looking at for the dental, it would be a family.
That's what that's what I was confused.
Yeah, yeah.
Okay. Will it be $890 per person, or is it $890 just one flat fee, like every 2 weeks?
It would be $890 for an employee only. Anything if you're signing up a child, then it's going to go up to just two tiers there. It's either employee only or family. Okay, so the dental and the life disability don't have the spouse option or the child option. It's just either employee or family.
Okay. I was just wondering if it was $890 per child, but it was just me. It's $890 every 2 weeks.
Mm-hmm.
No, if you're doing a family with you and your children together, he's saying it would be $78.10 out of each paycheck. Is that what you were saying?
No.
I'm talking about term life. I'm talking about the term life plan.
Yeah. Yeah. Keep in mind, this would be so it's not per person here. Okay, so if you're looking at the family dental, let's say it's you, a spouse, and two children, the price is still just $25.50 coming out of your paycheck every other week. It's not $25.50 times 4 people. It's just $25.50 for the entire family. So whether you have 2 children or you have 10 children, it doesn't matter. It's still $25.50 coming out of your pay. Same thing with the life and disability. The price does not change.
I have a question. Like, can I choose employee only for a medical plan and family for dental plan?
Yes.
I don't have to choose employee and family for medical to choose family dental plan.
Correct. Correct. If you wanted to do employee only for your medical, you would just check the box saying employee only for medical at $15.18. Then you would check the box that says family for dental at $25.50, and that would be it.
Okay. So we'll have a separate dental card for it?
Correct.
Okay. And we have medical card. We have prescription card and dental card. So
yeah, but the medical card and the prescription card are all in this. That's just one card. So your medical card is your same thing as your prescription card.
Okay.
You cover vision too, correct?
Yeah, vision, but vision you don't get a card. Vision is just embedded in the product itself. So when you go to all you would do is if you were going to, again, VSPs are network. So let's say you went to your eye exam, place to go get an eye exam. You would just they ask you for your social security numbers. All they're going to do when they plug that into their system, and you'll be in there.
Okay. Sound better than United Healthcare.
What's that?
Sound better than United Healthcare. They want your whole shut.
Well, it's different. You got to keep in mind that these are completely different. This is not comprehensive major medical. So whereas United Healthcare is going to be much more expensive, at the same time they do cover you for a lot more. Especially, God forbid, if something ever did happen to you where you had a heart attack or got diagnosed with cancer. If you got diagnosed with cancer, then $500 a month is going to look like a godsend that you're paying in premium. Because I'll tell you what, I mean, you can be talking millions of dollars of claims. So you are looking at two completely different types of insurance. They both accomplish they're only the same in the sense of the preventative services. That's really it. Once you start getting above and beyond that, we're certainly qualified and good enough to help you out with day-to-day expenses and help reduce your out-of-pocket cost. But if you do become critically ill, I mean, this is something that is not comprehensive major medical. You're going to have some bills.
Yeah, but keep in mind too, though, that there's always the marketplace, you know.
Yep. Well, and that's the other nice thing about our plan too. So this is one other thing you have to keep in mind. You know, you can still enroll in the marketplace with our plan. Okay, because we offered you this, you can still go say, I'm not interested in this. I'm going to go to the marketplace and see if there's an option for me to get comprehensive major medical. That is the beautiful thing about our plans, is that, hey, if I just want something low cost that helps me out with the day-to-day things and keeps my costs at a minimum, great. But if I need health insurance, I need comprehensive major medical, I know I have claims and costs to happen year in and year out, then you're going to want to look at something like United Healthcare or the marketplace. That's something that you have to evaluate. I mean, I always say the same thing to people too, whether you're evaluating our plan or the marketplace, especially if you have children. I mean, you might have an option like CHIP or something else. Is it worth signing up for our plan, or is it worth utilizing CHIP? So you have these different things out there that you as a consumer have to really pay attention to and do your homework on.
Great. Appreciate that, Joe. Thanks a lot for the information that you shared.
That's a very valid point, because a lot of the times, because the incomes here are so low, their children qualify for CHIP at a very low rate.
Mm-hmm. Well, and same thing with our plan too. I mean, if you qualify based on your income level, let's say you qualify for Medicaid, or because of your age you qualify for Medicare, those are programs that you don't want to utilize any of our insurance, whether it's myself or United Healthcare. You want to be on those programs. Those are government programs that are designed to keep your costs relatively low. So those are things you need to do your homework on. CHIP, same thing. So those are programs you do have to do your homework on and pay attention to.
All right. Are there any other questions?
I don't have no more.
No? Okay.
Just to be clear, if they're presently on the plan and they don't want to change anything, they do not have to enroll again.
Correct.
Okay.
But just keep in mind, the reason why I'm bringing that up is because let's say they want to sign up for dental. If somebody's currently enrolled and they send me an enrollment form that says dental only, that's the only box that they check, my people on my processing team are going to look at it as, okay, this person doesn't want medical insurance, they just want dental. So if they are currently enrolled in our medical plan and they want dental or they want disability, make sure they check both the medical box and the dental box. Make sure they do both.
Mm-hmm.
One more question. If an employee wants to drop this insurance in the middle of the year, do they need to fill this form?
No, I mean, all you would really have to do is just let the people within your department, your HR team, whomever that may be, just let them know that you're dropping coverage and we'll process it. So you don't need to fill out any paperwork per se. Just let us know.
Thank you.
Mm-hmm.
The other thing is, a question was just asked to me, when is the deadline for any sign-up? We must get all the forms back by the 23rd of December, the 23rd.
Okay.
All right.
So
Any other questions?
Send it back to TriMed, right?
Yes.
Okay.
And let me add, these are all good questions too, by the way. These are some very good questions. I think they're questions that other people will have as they view this recording at another time. But let me ask, are there any other questions at this general moment? No. Okay.
I don't have any more.
All right. Just allow me the opportunity to just offer a few pieces of thought here. One is that hopefully you see that TriMed is trying to offer a comprehensive plan that's going to meet the needs of everyone. So there's the United Healthcare plan, as we mentioned already, is a comprehensive major medical coverage plan. So again, if you think you need those type of services, then that should be the one you should gravitate towards. If you feel that you're maybe not there at that particular point in time and you like what you've heard in reference to Reliance and you believe that Reliance Standard can meet those needs, then then again gravitate towards that. Then you have all the forms that are necessary, and you know the time frames to get things done. But let me just add a couple other components to overall what we're doing here to try to bring everything in together. When it comes to financial planning, if you will, and planning for a family, it's, you know, some of the things that we've talked about are essential. Healthcare coverage is essential, that you have that. I mean, that's the number one thing that you need, because 1 or 2 days in a hospital can definitely leave the pocketbook well drained. So that's number one. Number two, the other thing that Joe mentioned was the reference to the dental coverage as well as the short-term disability and the life insurance. And I'm going to focus in on the life insurance and the short-term disability at this juncture, just to let everyone on the call know, plus those who may be listening in the future, that you as the breadwinner are pretty much the most important person in the family, not in the sense of the fact that you're the breadwinner, but also the fact that you're the essential part of the family. But the reality is, because you bring in those dollars on a regular basis, the family gets accustomed to that. So if you were to have a disability or if you were to pass away, then there's going to be a tremendous void in the family. And then the standard of living is going to shift from that point on. And in many cases, when it shifts, it's going to shift lower. So that's why it's important that you look to put in place those things as short-term disability and the life insurance place. So just in case something happens to you, because you're the breadwinner, there'll be something to replace that until you're able to get, in the case of disability, able to get your health back on track and you're able to get back to work. So just keep those things in mind as you do your planning and as you consider what needs to be done for protection of your overall family. All right. So I'm going to just turn this over to Mrs. Jordan, just to ask. I mean, is there anything else that you would like to say at this juncture?
I
No,
have.
except that, Joe, you were saying something?
Can I just ask? Can the employees just take the term life only or dental only without taking a medical plan?
Yes.
Joe, are you okay?
Yes. Yep. Yeah. You don't have to. You do not have to enroll in our medical plan in order to get access to the other products. If you just want dental insurance, you can just sign up for dental insurance. That's perfectly fine.
Great. And okay, we'll need the manuals later.
What's that? Sorry.
I'm sorry.
Manual about these products, because you have brought new products. Last year we have something and we have some more additional coming up, and those papers.
Yeah, the manual you would get in the mail. We would send you the manual. We have them here. We would send you. We rushed off the enrollments with some with some information, 1 or 2 pages about the additional products, but we have a bigger manual that will come to you in a package for you and your team.
Okay.
Ladies and gentlemen, ladies and gentlemen, if we don't have any more questions, let me just take the opportunity to thank United Healthcare and Reliance for walking us through this. Thank Roger for coordinating it. Thank you all the employees. Please, we want you to register. That's why we are offering these plans, that they're inexpensive to us. And if you have any questions at all, please call our office line, okay? So
can I make one more point real quick, Bev? I'm sorry. Can I make one more point? If you decide, folks, everyone on this call, and if you're going to hear this in the future, if you decide that you're not going to utilize United Healthcare at this time, there's a waiver form. Just sign that form and just say that you're not going to accept this coverage, and please turn that into TriMed. That's very important.
You have to sign in the decline form, yes.
Decline? I don't have a decline form.
Yeah, the application form, you either accept or decline, so you have to check the decline and sign and send it in.
Okay.
The enrollment form has a decline option.
Okay. I have to hang up, you guys. So thanks for everything.
Ron, thank you.
I have to get my children. Okay.
Yeah,
thank you.
Bye-bye. Bye.
All right.
Thank you, everybody.
Great. Thank you.
All right. Thanks, everybody. Take care.
Bye-bye now.
All right.
Okay.